What a week it has been, buzzing with so many health news hitting headlines. Be it Salman Khan's announcement regarding his neurological problems or research indicating that ChatGPT is making us dumb. India also has a new weight loss pill hitting the market. Wegovy has been launched in our country. A lot of people are still grappling with travel anxiety after the crash of AI 171. So we are breaking that down for you. We're explaining travel anxiety to you as well. Also decoding extreme allergic reaction that killed businessman Sanjay Kapoor. I'm Sneha Mordani. This is Health 360. Well, let's begin by telling you about a piece of research that would shock you a little. Well, it did get me to think about my reliance on artificial intelligence as well. Thing is that a new study indicates that artificial intelligence and over-reliance on digital tools like ChatGPT is making us dull and dumb. Well, there is no other way to put it. Here's more. Right, there was a time, remember, when we would remember a couple of telephone numbers that would be at the back of our mind, isn't it? Apart from your own telephone number, you would easily, without looking into your diary, dial some other phone numbers also on your cordless phone or your landline phone. Well, the culprit here is ChatGPT, and the idea of memorizing stuff is just so 20th century. Essentially, it has been found by the Massachusetts Institute of Technology that students who rely on artificial intelligence like ChatGPT for their work essentially are becoming dumb. What is now being said is that their cognitive skills is getting impacted. What's also getting impacted is their critical thinking. And this research just speaks volumes of how artificial intelligence is preventing us from using our minds, from applying ourselves. Well, what is being assessed right now is that in the next 10 to 15 years, we could be losing our ability to think and analyze, just like we have lost our ability to memorize right now. Now, what the researchers did is this. They chose 54 participants between the ages of 18 to 39 in the Boston area. They asked them to write essays either using digital assistants or using non-digital assistants, basically applying themselves, which meant that they were asked to use OpenAI ChatGPT or Google search. Others were asked not to use digital assistants. They meanwhile monitored their brain functioning, essentially scanning their brain to look at the cognitive engagement there. Essentially found that those students who were not relying on digital tools, were using their minds, were applying their brains, showed more cognitive engagement in their brains as opposed to other students who were heavily relying on OpenAI. In fact, the essays were called soulless by the researchers of those students who were relying on ChatGPT. It shows less brain activity, also less critical analysis thinking, which means they're not using their mind, as opposed to the other students who were not using digital tools like OpenAI's ChatGPT. They were doing their mental legwork, and that is something that should be done. The thing about brain rot is that you don't know until the time it's too late. It's like gaining weight, becoming unfit. You don't know until it is too late, until the time your pants don't fit in or you're trying to walk up a flight of stairs and then realize how unfit you've actually become. Now, while working on this story, I was also using my phone and I kind of just thought which was the year when the first iPhone was first introduced. Well, the year was actually 2007. I actually had the first iPhone. I lived through that era. But what did I do? Did I get my brain to do some legwork and think about this? Or did I type into ChatGPT and ask this question to ChatGPT? Unfortunately, I ended up using ChatGPT. Look around you. Chances are you will meet people who would not want to fly. Take any flight anytime soon. Well, the week gone by has seen a drastic increase in what is known as travel anxiety. The horrific crash of AI 171, which is still unexplained. The horrific pictures of the accident is etched in the minds of people world over. More so seen in India because of the uncertainty around air travel. Hundreds of flights have been cancelled repeatedly over the last few days. Air India has been in news for all the wrong reasons. Well, it is not just Air India though. Not sure if you're just shaken after a recent crash or if it is something deeper. Well, here are some signs that may point to growing flight-related anxiety. Avoiding work trips that require flying. Feeling dread or panic when travel is mentioned. Obsessively following news about flights or aviation incidents. Trouble sleeping before a scheduled flight. And experiencing physical symptoms like heart palpitations, sweating or nausea just thinking about getting on a plane. Well, if these symptoms last more than a couple of weeks or begin to interfere with your work, travel plans or overall peace of mind, it's a good idea to reach out to a mental health professional. Feeling anxious after crash news? Remember, flying is still incredibly safe. Air travel has a remarkably low accident rate compared to other forms of transportation. For example, MIT research indicates there was only one fatality for every 13.7 million passenger boardings between 2018 and 2022. Try calming techniques like deep breathing or mindfulness to ease tension. Don't keep your fears inside. Well, talk to someone you trust or a professional if required. Picture yourself on calm, smooth flights you've had before. If anxiety sticks around, therapy like CBT can really help. Rare air disasters hit hard because they trigger deep fears, but you can take back control. Rare air disasters hit hard because they trigger deep fears, but you can take back control. And joining us right now is Dr. Astik Joshi, child, adolescent and forensic psychiatrist at Fortis Hospital in New Delhi. Thank you for your time. You know, the brain responds in a very different way to flight incidents, even from a distance. It stores it like a real memory. Explain to us what happens to the human mind in situations like these, where you see yourself consuming news items of this kind. It's constantly there before you. You're looking at it. You're hearing about it all the time.
In situations like these, in which there's a traumatic event and we tend to experience the traumatic event through visualizing or through seeing it on the news, what happens is the brain tends to perceive it in a way that this is actually going on in reality. So it is not virtual, in a way it is real. So if there's a real, if the body perceives it as a real traumatic event, the brain goes into fight or flight response. And in this, the brain tends to have the decision making which is overridden with emotion instead of logic, and that may be counterproductive.
You know, Dr. Joshi, sometimes just the information overload and emotional weight of this news can trigger your brain's stress response. You know, what should the person do if he or she is actually overwhelmed with fear?
If a person is being overwhelmed by fear, it is necessary that they practice appropriate and healthy coping mechanisms to cope with that fear. What I mean by healthy and appropriate coping mechanisms to handle with fear is to do the logical things. Firstly, for example, stay away from social media, stay away from media if it is giving you information overload. If, in addition to that, practicing healthy coping techniques such as physical exercise, eating a balanced diet, sticking to your routine, having your sleep schedule which is normal in nature. So all of these things are important in order for an individual to cope with fear.
And I'm going to thank you for joining in and sharing your views with us today. Well-known industrialist and polo enthusiast Sanjay Kapoor, ex-husband of actor Karishma Kapoor, lost his life recently after being stung by a honeybee during a polo match. A simple sting, something many of us have experienced and brushed aside, turned fatal due to a severe allergic reaction known as anaphylaxis. His untimely demise brings to the forefront a life-threatening medical emergency that is still poorly understood and under-recognized. It is being said that food-dependent exercise-induced anaphylaxis, or FDEIA, could have led to his death. So what is FDEIA? Well, it's a rare but real phenomenon where an allergic reaction is triggered only when certain foods are consumed before exercise. The overlap of a bee sting, physical exertion, and a possibly sensitized immune system could have created the perfect storm here. These incidents are all wake-up calls. Anaphylaxis is a race against time. But with the right awareness, timely intervention and preventive strategies, lives can be saved. So what really is anaphylaxis? Anaphylaxis is a rapid onset, severe allergic reaction that can affect multiple organ systems, skin, respiratory, cardiovascular, gastrointestinal and nervous system. It may start with simple symptoms like itching, rashes, lip swelling or throat tightness, but can escalate within minutes to breathing difficulty, a drop in blood pressure, loss of consciousness and even death. Well, common triggers include insect stings, bee wasp ant, foods like nuts, shellfish, milk, wheat and fruits, medications, antibiotics and NSAIDs as well. Exercise, especially after certain meals, latex, cold exposure or unknown causes. Now, in the case of Sanjay Kapoor, the honeybee sting was the likely culprit. However, if he had eaten certain sensitizing foods before the game, food-dependent exercise-induced anaphylaxis can't be ruled out. The golden rule always is, if two or more systems are involved, which is skin, respiratory or gut plus heart, it's anaphylaxis. Every minute matters. So at the end of the day, one big question remains about what could have possibly happened to businessman Sanjay Kapoor. I'm being joined by Dr. Neeraj Gupta, allergist and pediatrician, senior consultant at Delhi's Sir Gangaram Hospital. Thank you for your time. Talk to us about anaphylaxis. What are the signs and symptoms of this? Just decode this for us.
Allergy can be presenting to us in different forms. Something which is we are inhaling, something is going through the inhalation route by the air. We might get some cough, cold, runny nose, blocked nose, some watering of the eyes, and then sometimes chest tightness, chest wheeziness. Similarly, if something which is ingested, you have taken something orally, and at that time somebody is allergic to it, then he might get some nausea, vomiting, abdominal pain, loose stools. So these things can happen. Abdominal pain can be very severe also. Something which is coming in contact to the skin, then at that time you can get some rashes, some itching or some swelling in the skin or in the lips. So these could be different symptoms of allergies.
So right, doctor, tell us, what saves lives in a case like that? What's the role of the EpiPen? What medicine really is that?
Epinephrine is marketed as the name as EpiPen in the West. It is yet not present in India, so there are very, you can say, like limited places only which you will get EpiPen, otherwise it is not freely available. So this EpiPen is life-saving, so a person need to know that okay, this EpiPen is there and how to use it. It is important. So the patient himself or the person himself who is experiencing the symptoms, he need to inject EpiPen immediately. Usually the injection of the EpiPen is the anterolateral part of the thigh. So usually we say that just open the EpiPen, inject it and then release it, and that's done. So this is how you can actually treat or prevent an acute episode of anaphylaxis. The other important thing is that whenever you are needing an EpiPen or epinephrine, so immediately the life-threatening situation will become controlled.
Also, what are the precautions that need to be taken, if any?
With the common allergy testing which are now available with the allergy specialist, you can actually detect that, okay, to which things you are allergic to. So you need to prevent, you need to avoid those particular things. If you are allergic to a particular food item, you need to avoid that food item. If you are allergic to a particular drug, then whenever you are going to a doctor, you need to tell him that, okay, I am allergic to this particular drug, so that the doctor can avoid that particular drug and he can give you an alternative solutions. If you are allergic to certain insect, then at that particular time you can take certain precautionary measures to avoid again contact with the insect. The other important thing which is important, as I mentioned earlier, is about EpiPen, or the life-saving, or you can say like injection, which should be available to every person who is at risk for anaphylaxis.
All right, I'm going to thank you, Dr. Neeraj Gupta, sharing those details with us at this point in time. It's time for a quick commercial break here on the show. We're getting you much more news around health, wellness and fitness on the other side.